We got a better idea today of what Massachusetts schools will look like this fall, and it'll be very different from when they left in March. New state guidelines will require face masks for all staff and students in grades 2 or above. All desks will have to face forward and should ideally be 6 feet apart, but 3 feet will be the minimum allowed. Students must be divided into small groups, and intergroup contact should be avoided. Hand washing or sanitizer will be required upon arrival, before eating, putting on or taking off face masks, and before dismissal. And all schools must have a designated isolation space for students who show coronavirus symptoms. Maybe the toughest part is that schools need to plan for 3 different possibilities: full in-person learning, full remote learning, and a hybrid of the two. Governor Charlie Baker said today the goal is to balance kids' safety with their other needs.
In developing the back-to-school plans, the department and our administration considered not only the risks associated with COVID-19 for in-person schooling, but also the risks associated with continuing to keep students out of the classroom. Continued isolation poses very real risks to our kids' mental and physical health and to their educational development. This plan will allow schools to responsibly do what is best for students, which is to bring them back to school to learn and grow.
It is a tricky balance, and one many states are struggling with when it comes to schools, businesses, and life as we previously knew it. Now, with the coronavirus death toll surpassing 122,000 nationwide, and the U.S. seeing a new record in cases reported in a single day, at least some are considering their overall reopening plans. In California, where new cases spiked by nearly 70% in just 2 days, Governor Gavin Newsom says he is prepared to revert to stricter rules and business closures if necessary. And in Texas, where infection rates have doubled in recent weeks, Governor Greg Abbott has hit pause indefinitely on all future phases of reopening.
You need to understand COVID-19 is still here. Is spreading faster than ever before.
It's because of that growing spread that New York, New Jersey, and Connecticut, once hotspots for virus outbreaks, are now requiring anyone coming from current coronavirus hotspots to quarantine for 14 days. Rhode Island's governor is also considering a similar restriction. Maine currently requires all out-of-state travelers to quarantine for 14 days or show proof of a negative test. And here in Massachusetts, all out-of-state visitors are advised to self-quarantine for 2 weeks. But are these policies really enough to keep new outbreaks at bay? And are they even enforceable? Joining me are Juliette Kayyem, a senior lecturer at Harvard's Kennedy School of Government and a WGBH and CNN contributor, and Sam Scarpino, an assistant professor of network science at Northeastern and the head of the university's Emergent Epidemics Lab. Thank you both for being here.
Thank you.
Let me start by asking you, Sam, from an epidemiological point of view, how worrisome is a scenario in which Massachusetts, New York, New Jersey, Connecticut, other states that have done a pretty good job containing COVID-19 might see upticks related to people coming from hotspots to visit family or, take a new job, something like that? Is that a source of real concern? Or is it actually not that worrisome?
I think it is a source of real concern. We're seeing cases skyrocketing in places like Texas, Arizona, increasing case numbers in California. These large states share lots of family across the United States back into New England, Massachusetts. And so there is a risk of individuals coming back into our populations. It's why it's so important to be very serious about mask wearing, physical distancing, other non-pharmaceutical interventions that we have in place.
When you mentioned staying serious about that stuff, I drove in from my home on the North Shore to WGBH to get some equipment to broadcast this show. And I have to say I was crestfallen at how many people along the coastline were not staying far apart and are not wearing masks. Maybe they've got them pulled down, maybe they just don't have them at all. But Juliet, let me ask you, what mechanisms do you think would be effective when it comes to actually getting people to keep to themselves, to self-quarantine, if they go to a new state? And I'm especially interested in the way we're doing it in Massachusetts compared to other states. I'd like to hear if you think we're going far enough.
Right. So, this is the challenge. This is happening. because of the failure of having sort of a unified national strategy, because each of the states were sort of left on their own. Some governors could be really lax, as you saw in Texas, and now Governor Abbott is all of a sudden waking up and, you know, smelling the dead roses, so to speak. Or you have Arizona, where Governor Ducey, you know, is now just realizing what's about to happen. And so each of these states is now trying to figure out how, now that I've done something right, how can I make sure that I'm just buying time. That's all we're doing now. There's no good treatment. There's no vaccine. There's not even strong social distancing in most of the states anymore. And so basically, we just have to realize that what we're doing is just buying time to either hope for better treatment, or maybe the virus will not be as strong, or maybe that buys us time to figure out how to live with the virus better. That's essentially what we're going to do for the months, if not years ahead. And so mask becomes part of that buying time. And what I describe to people is, you know, there's no quick fix, right? We just know this now. And so what we have to think is just what combination of strategies is going to minimize the risk to us and then therefore our families and communities. And mask is a key part of that. So is social distancing. So is making sure your contact intensity is limited. So, you know, maybe gyms can wait, making sure the number of people you're around is limited. So that's why we do have restrictions on restaurants. And then making sure we individually do everything possible in the absence of, you know, sort of strong regulations or legal guidance at the top.
What counsel would you give, for example, Governor Baker, if he came to you and said, hey, I know that you have spent time in the public sector. I want to make sure that when it comes to this particular risk, people bringing the virus to Massachusetts from current hotspots, I want to make sure we're doing everything we can. Is that advisory that went on the books back in March enough? What would you tell him?
I think it is enough. I mean, in the sense that it's not at all clear how any of this will be enforceable, nor do we have a capacity to determine who would be violating it. I think the operation be very difficult. Where I would say is, look, there's a lot of things to worry about, and the key thing to worry about is, do we have sufficient testing so that if someone does exhibit symptoms, that we can then test and trace. And I think that was correct of the governor to focus on that, because the pool of people that could be coming in, I mean, we're a pretty small state. You could get to New Hampshire in, 25 minutes, depending on where you are. You could get to Connecticut in the same amount of time. So it'd be hard to control the interstate traffic. I think what these governors are doing is basically making a statement that the federal government has failed to make, which is everyone should basically stay put. Stay in your cars. If you're going to go on vacations, stay in your cars. Don't go out too much. And that's what I think they're basically saying is you're not just you're unwelcome, but this is really bad. I mean, this is really bad right now because the numbers are going up. But unlike in March, when everyone seemed committed to social distancing to flatten the curve, we're not doing it, and so I just don't see the end game here.
Sam, do you agree with Juliet that the state can't really do much more than go with the advisory that is currently on the books? Or do you think there are steps that could be taken that we're not taking right now to deter people coming in and potentially bringing COVID with them?
I certainly agree with Juliet that the enforcement piece is not at all clear. However, I do think that what is very important to remember is that there are a lot of individuals out there who are confused. We hear tragic stories from all over the United States. I thought it was safe. I thought it was safe to have a family gathering. I thought it was safe for there to be a surprise party. I thought it was safe for me not to self-isolate when I came into the state. And so I do think that one of the reasons we may want to consider stronger language around some of the non-pharmaceutical interventions is that communicates to people, at least tries to communicate to people more effectively, that the risks are very real and very severe. And so I think we do need to balance making sure individuals are well informed about the risks, the severity of the situation, the risks to their own health and to their family's health, so that they can appropriately balance them as they're making decisions about going on vacation, about holding family events, about trying to resume some of these important aspects of life that Governor Baker mentioned. There are serious mental health issues associated with, long-term isolation. It's one of the reasons we call it physical distancing and not social distancing. And so we do need to balance all of these different demands. I think that because there's such a void at the federal level around communication, there should be an onus on the governors to have very clear and strong language around how people need to be prepared to keep themselves and their families safe.
Sam, can you give me an example of maybe one piece of language here in Massachusetts that you would like to see strengthened, a message you'd like to see delivered more forcefully than it's currently being delivered?
I can think of a number, but I think probably the most important is around mask wearing. There have now been many studies showing that if you have 80% plus adherence to mask wearing, COVID can be controlled. Now, you're still going to have the occasional super spreading event, which is why the contact tracing is so important, why the case isolation is so important. But we know that mask wearing is a big piece of this puzzle. And I think that the language in the state right now, which has been the language since the mandates went into place, is that if you can maintain safe distance, then you don't need to wear a mask. And you cannot be sure you can maintain that safe distance. You cannot be sure as you're going from your car to the beach that you won't bump into somebody and be within 6 feet of them. And so I think we need much clearer language around how critical it is for people to wear masks, especially if we want to be able to reopen aspects of the economy, keep the case numbers down, and that because you cannot manage all of the uncertainties in your day-to-day life, really mask wearing should be mandatory for anyone that doesn't have a medical condition that would preclude it.
Juliet, I think I saw you nodding.
Yeah,
I
mean, I'm not a doctor, and so this is, I could not agree more. There should be no ambiguity in mask wearing now because other states are experiencing some really bad stuff now. We don't have as strong as social distancing. We do want to get out. We want to get the economy moving. That economy is not going to be moving if, as we're seeing in Texas, as we're seeing in California, as we're seeing in what I call, the confidence index, right? That even though things are open, I haven't gone to a restaurant yet. I mean, just in the sense that my own, confidence level isn't incredibly high right now.
Yeah.
Masking gets us really far. It does. And that we're going into summers outside. There's no phone call exception to masking. There's no I'm out for a run exception for masking if you're somewhere crowded. There's no I'm just popping into the car or the dry cleaner exception. It should be very forcefully stated by every level of government at this stage because we're running out of tools. I mean, there's not, but there's not that much left unless we want to go back inside. So I'm all for that.
All right, we got to leave it there. Juliette Kayyem and Sam Scarpino, thank you both for being here.
Thanks so much.